In general, children are less susceptible to the coronavirus than their parents or grandparents, but the pandemic is still taking a toll on them. A recent study found that quarantine and coronavirus restrictions have sent kids on an emotional roller coaster. During his research, Dr. Philip Fisher, a neuroscientist at the University of Oregon, noted increased separation anxiety and kids having trouble sleeping, as well as increased fear. It's leading him and other researchers to question what the lasting effects of quarantine will be on children who are still in the early stages of their physical, emotional, and cognitive development. For more, I'm joined by Lisa Miller. Lisa is a contributing editor at New York Magazine. Her article, Children of Quarantine: What Does a Year of Isolation and Anxiety Do to a Developing Brain?, looks at this study and how the pandemic is affecting children. Lisa, thank you so much for being with us. Your piece was so compelling on so many different levels. First of all, what were the major findings of this study, and were there groups of children that were affected more than others?
I mean, the major finding of Phil Fisher's study is that the kids who are struggling most before the pandemic are struggling even more in the pandemic. So, kids with disabilities, kids whose parents are having a hard time making the rent, kids who are food insecure, kids with disabilities, I said that already, kids who are living in marginalized communities, kids who are, for whatever reason, like off the grid, homeless kids. Those kids, the effects of this pandemic, this quarantine, this isolation, are really terrible for them.
When my kids were little, I read about this concept of serve and return, and I saw that it was in your piece. As you can imagine, like a lot of moms, you try to get your hands on all kinds of early childhood development research. But explain this concept, which is really critical, serve and return. Explain, first of all, what that is and how it factored into the research.
Right. So serve and return is this very essential evolutionary dynamic between parents or caregivers and their very small children under 5. And it's that thing that all parents do really naturally, like your baby offers you a plastic toy and you say, thank you. And then you give the toy back to the baby. And it's this, or the baby fusses or cries and you lift the baby up and you smell her diaper. Or, there's a kind of constant interaction dynamic between a caregiver and an infant and a toddler that's essential to good, healthy brain development, and that is really bolstering for little children at a time when their brain is very plastic, and helps them develop into mature, healthy adults. That's what serve and return is. And the problem with the pandemic,
Yes. I was just going to ask you, what happens now in the midst of a pandemic where you have stress levels of caregivers going through the roof, that a caregiver may physically be there, but not necessarily able to engage in that kind of back and forth serve and return interaction?
Right. I mean, that's the problem, right? The more stressed out a parent is, the less, or caregiver, the less he or she is able to give a young child that kind of consistent back and forth dynamic attention. And the less a parent or caregiver is able to give a kid that attention, the more that child suffers. And so, in the most extreme cases of this, we're talking about children raised in orphanages in Eastern Europe. They're very, they suffer a lot without a bolstering, nurturing caregiver in their lives. But even, and this was what Dr. Fisher was so compelling about, even in a crowded house, as we all are here now in isolation, with a parent or two parents who are trying to work to pay the rent, who are like preoccupied and worried about the bills, and there are other kids who need help with homework, and even in that situation where there seem to be a lot of people around, the young children can still suffer because there's nobody giving them that consistent back and forth nurturing attention, that serve and return.
And I don't want to give away the whole piece, but can you just talk about, Lisa, how that actually then manifests itself later in life? Because when you say that the children suffer, we are talking about, in some cases, lifelong consequences as a result of what happened during those early childhood years.
Definitely. I mean, cognitive delays, behavioral issues, addiction and substance abuse issues, problems in relationships, problems with authority. The environments that some children, many children, increasing numbers of children are being raised in are environments that the doctors and psychologists are starting to call toxic stress, which is just a kind of intense or acute or prolonged adversity. And when kids grow up in those environments, the long-term mental health effects are really, really dire. And they're not just psychological effects. They can also be medical effects, like kids have a higher rate of diabetes, higher rate of early death, higher rate of other kinds of diseases. I mean, this kind of adversity on kids is really, really dangerous. And the numbers of children who are suffering under these conditions were already too large before the pandemic and now are growing larger because their parents can't intervene and help them. Yeah. Sorry.
That's right, yes. Well, based on his research, no worries, we have a bit of a delay here, but what does Dr. Fisher believe the lasting effects of the pandemic will be on the population of children as it is right now? And also, what can be done to counteract those effects?
Right. Well, I mean, there's hope, right? There's hope. If the Congress can pass stimulus and give some parents a break, then the parents may have some bandwidth in which to, pay more attention to their kids. So that's one thing. And that's a really important thing. Like, parents need relief. They need help. We need to talk about childcare in America and who actually is responsible for taking care of children, because millions of American women, mothers, have quit their jobs in order to take care of children who are not going to school, and they're sacrificing income for their families. So there needs to be a much bigger, broader conversation about childcare and whose job it is to take care of children. And then within our own families, we can do things that help buffer the effects of the pandemic. One is to try as much as possible to have a predictable schedule. Children thrive in predictability and they are distressed in unpredictability. So even when you're having a hard time, if kids know that Wednesday is pizza night, if kids know that, on weekdays from 8 to noon, parent is working, like, that's helpful. And then the other thing is that when a parent is at her wit's end, at the end of her rope, if she can just say to her kid, like, I'm really stressed out and I'm going out for a walk, or I'm going to go read a book, or I'm going to do some jumping jacks and I'll be back in a minute. I think a kind of expressing to the children that, it's hard, but we're managing, and this is how we're managing, is really helpful, because kids can interpret what that means instead of it being surprising, inconsistent, impatient parents, parents who are really tapped out. That's really hard for kids.
Yeah, so much good advice. Lisa Miller, thank you so much. Really appreciate your time.
Really, really happy to be here. Thank you.